My suggestion about reducing anxiety prior to an assessment would vary from kid to kid, but it's essentially to make it not a big deal. The process of an assessment at our clinic is a diagnostic interview, which is where you're just going to come in and you're going to talk about what's going on. And so I would, if a child has a lot of questions about that, I would in a very straightforward way say, we're just going to talk about what you like and what you don't like and what's going well and what's not going well, but to really de-emphasize the clinical or the pathological nature of anything that's going on, because we're really just having a conversation. As far as the testing, our clinicians will do a lot of trying to reduce the anxiety or the fear of that process at the end of that diagnostic interview. But as far as if that is expressed to parents between the sessions, really we're just going to do some different activities. We might fill out some forms that ask some questions about yourself. I will often say that we're going to make parents do more of the work because they're going to be filling out some forms. So we really just try to normalize that process as much as possible. It can seem scary. It's certainly not something people do every day. So the more we can just normalize that process, I think the better. What I find a lot of times too is the kids who are the most anxious are the ones who think that they're going to get a shot. So a lot of times it's worth asking or just telling the child, no, there's no shots involved. And that may preempt some of that nervousness.